Folliculitis Barbae. That is the rash that you get when you shave your hair too often. I know it's nice to be fine boy, get those shapes in place and cut your hair often. But when you do that, you stand the risk of developing folliculitis barbae. So folliculitis barbae is more an reaction, or rather an inflammatory reaction to hair that penetrates the interfollicular skin. So basically what happens is you develop this around 2 to 5 millimeter kind of papules, goes round usually at the edges, at the sites of hair removal, and they can be difficult to treat. Sometimes they end up forming keloid scars, and keloid scars are terrible because you can't remove them with ease. If you surgically remove them, they come back bigger. Sometimes they scar like that. Sometimes there's secondary infection, and there can be potential for complications. And if these things happen, it affects the psychosocial and confidence of the man. And that's why you see some men with all sorts of bumps on the edges of their hair, the back, and these are usually because they've been to the barber too often trying to look good, and then at the end of the day it becomes counterproductive. So everything in moderation. You should go to the barber, you should cut your hair, you should shape the edges. You should look like a fine boy, but you can't do that too often. Now, once you realize that you've developed folliculitis barbae and you see those spots, those pimple-like things at the back of your hair or wherever, at the edges where you shave, the reasonable treatment is to reduce the frequency of you shaving your hair, reduce the frequency of going to the barber, try and create, hair if you can, and just allow your hair to grow. If you can't do that, you could try laser treatment. But if you're fair-skinned, laser treatment works better for people who are fair-skinned. The darker you are, if you're Fitzpatrick skin type 6 like myself, then laser is not likely to work. But if you are a blonde person, you have a better chance with laser treatment. But in general, just stop the shaving, or at least increase the interval for shaving, and that would help you. If you have not developed it, then just prevent it. Reduce the interval of shaving your hair. Especially if you shape your hair, you can make it in such a way that it's not too low, it's not touching and scraping the skin, and you don't have to shape the edges every time you go to the barber. So those are ways you can try and avoid folliculitis barbae. It spoils fine boyship.